I'm Dr. Joanne Watt. I'm GP Chair of Northamptonshire CCG, and I'm here today just to talk to you a little bit about our plans, what's going on in the future, and tell you about where we're going as NHS Northamptonshire Clinical Commissioning Group. I'm here with Toby. Toby, would you like to introduce yourself?
Thanks, Jo. Hi, everyone. I'm Toby Sanders. I'm the Chief Executive of the Clinical Commissioning Group and also the Executive Lead for the Northamptonshire Health and Care Partnership.
One of the things that we know is very much on people's minds at the moment is the COVID pandemic. We know that many of you have been affected by this, either directly through friends or family, or even just by the restrictions that we're all living through at this time. It is a really difficult time for people, and we know that it causes a lot of worry for people. Toby, do you want to just tell me a little bit about the CCG's role within this pandemic and all the things that have been going on?
Yeah, absolutely, Jo. And just to start off with, really, before turning to the role of the commissioning group within this and our staff, just to convey my thoughts for all of the families across the county this year who've had their lives affected by the COVID pandemic. It's touched on all of us, and we know also very sadly that many families will have lost loved ones much sooner than expected as a result of the impact of coronavirus across the county. And the commissioning group, of course, has been very much at the centre of how we've managed the response and supported all of our services and staff, as well as patients and the public across the county over the last 7-8 months. Right at the early stages of when we went into the first wave of the pandemic, the commissioning group here in one of our headquarter offices in Northampton at Moulton Park, we established a multi-agency coordination centre, and that was working really closely with local authority colleagues, with the police, with fire, with military support, and really through the first 3-4 months of that original national lockdown period, and then coming out of that, that was very much kind of the hub of the response across the system as part of our multi-agency efforts. I have to say, Jo, and I know you share this, the response from all of the different agencies working together through that period was just absolutely tremendous, and we're still seeing, notwithstanding the challenges, the real kind of impact on people's lives. The way that staff across all of our organisations, and including our own both clinical and managerial staff, worked was tremendous. We had lots of people doing things that really were not parts of their normal day job. So through lockdown, because of our kind of key worker status, I was still coming in and out of our office building regularly to meet with staff to plan our efforts in this work. And we were running distribution networks for protected personal equipment out of parts of our building at times. We were working with some of our military planners on some of the logistics for what was now coming through in terms of the testing sites that we were seeing in different parts of the area. And some of our staff were redeployed back into frontline services as well. So we had a number of clinical staff that worked for the commissioning group, not just GPs, but some of our nursing teams in particular, and our pharmacy teams who went back into practice to work in different settings. So, a real massive thank you from me to all of our staff and our partner agencies for the way people pulled together and have worked through that period. And I think, Jo, there's going to be so much learning coming out of the last 6-7 months, much of it about how we respond to real pressure situations, but also some really rapid changes to services as well, particularly the way that we use digital and technology that's kind of changed all of our lives. And I think that's going to be one of the real legacies about how health and care services evolve going forwards in response to the period that we've been through.
Yeah, and I think it's important to stress that we've all worked together as a system. This is not about any one party doing this. I think this is all of us have worked together to try and support the people of Northamptonshire, together with our colleagues in the local authority as well, making sure that we keep our population safe. And we know it has been a really difficult time. And obviously this still continues. It's still really, really difficult for a lot of people out there as we're going into winter. Obviously, normally a really busy time of year, even more so with this year. There are a number of particular challenges this year, and it's probably a good idea for us to tell people a little bit about our feelings about this upcoming winter and some of the challenges that we're going to be supporting people with.
Yeah, absolutely, Jo. Happy to start off just by sharing a few thoughts and reflections. And as you say, the period that we're now in, which is still very much managing and living with COVID at the moment, is a very different, intentionally kind of response to the first wave in the initial lockdown period earlier in the year, where along with the rest of the country, the NHS stood down a lot of its routine services. So we stopped routine elective treatments, outpatients, diagnostic tests in primary care, and in some cases in acute trusts as well. We kept all of our essential services running, and so general practice and community services and the acute trusts were operational and running and open through the whole of that period. But a lot of things were stood down and paused for a while. And through this summer period, we've really started to reopen and step back up again some of those services that had to be paused. And of course, the challenge going through the winter that we're now into is how do we keep kind of three things going all at the same time? So yes, we're continuing to manage across health and care services that response to the COVID pandemic. I'll perhaps say a bit more about each of these three in a moment, Joe. But secondly, as you rightly say, we've got the kind of what you might describe as more routine winter pressures that we always see at this time of year, particularly as the temperature changes and how that impacts on respiratory conditions and how it impacts on other kind of cold and flu presentations as well. And then thirdly, really importantly, alongside that, particularly because of some of the elective work that was paused earlier in the year, we're still very much trying to get back on top of some of the waiting lists and some of the treatments and procedures at more of a planned basis that we're trying to do. And we're trying to manage all those three things all at the time, and that makes this winter a really complex position for all of the NHS services across the county. But just to say a little bit more perhaps about the kind of COVID response through winter and how we're kind of approaching all of that. Clearly a huge focus on rolling out of rapid testing now in terms of moving forward across the county. I'm really kind of delighted to see the much bigger volumes now we've got coming through of the much more rapid 20-minute tests that are coming through, and that's going to be a really key part of how we start to kind of get back to some sense of normality through this. And alongside that, the commissioning group staff working with all of our partners heavily involved in planning and mobilisation efforts at the moment for the rollout of the really exciting news we've all heard over the last couple of weeks around the vaccination programmes, and therefore there's going to be a whole range of different locations across the county, some of them in general practice, some of them working with our staff within acute trusts and community services, and some also in some larger community centre locations, to make sure that we're in a position as soon as we get vaccines coming into the county to be able to roll those out to those priority cohort groups. So that's going to be a really important element of how we manage through winter. But in addition to that, all of the agencies, health and social care, have put together a winter plan for this year that has a number of additional elements to it. So we know in general practice we've got additional capacity going in through some of the hub sites that we're now running between groups of practices in different areas. We know that from an acute perspective, we've been doing a lot of work with adult social care, particularly around patient discharges and supporting people when they're medically fit and no longer require acute medical support in hospitals to get back to their normal place of residence, whether that's at home or whether that's in a nursing or a residential home, to enable them to be supported in that setting. And all of that is so important to making sure that when people do have that point of crisis, when they do need that higher level of support, we've got the capacity across the county to be able to support our patients and population when they need to reach out for that extra level of support. So I'm under no illusion, and I know we all know this is going to be a really challenging winter, trying to manage all of those three things at the same time. But we've got a tremendous staff across all of our services in health and care. And despite the kind of fatigue from the last 7 months, I know people are doing their absolute best to make sure we can support our patients and public, keep people safe, and make sure those services are there when people need them through the winter.
Absolutely. So challenging times, although obviously all of us are going to work together to make sure that the population gets the care that they need. We are aware that obviously things will look and feel different to people, and it's really important that, as I say, we support our population through that.
Absolutely.
Yeah.
So Joe, we've talked quite a bit there about some of the things that we've been involved with and the commissioning group's been involved with over the last sort of 6-7 months, and we've talked a bit about winter and the next autumn period as well. I'd be just keen to hear from you a little bit your thoughts on kind of some of the medium to longer term as we go forwards. So perhaps just to start us off, just be interested in your thoughts on kind of looking ahead over the next 12 months. What do you see as being the big priority and focus areas for us as a commissioning group working with partners locally?
Absolutely, and I think it's really important that we're able to look forwards as well, because all of the other needs are still there. So this is not just about COVID. People obviously have considerable both physical and mental health needs as well, and it's really important that we look after them, and we look after them in the context of the place where they live as well. In particular, one of the big schemes that we will be looking at from a commissioning group, but also from a system point of view, is something called ICANN. So integrated care across Northamptonshire, which is looking at the frailer members of our population, looking at their needs, very much focusing on how to support people with as much independence as possible, make sure that they're supported in the community, and support professionals to meet together to really consider what matters to that person. That where they are admitted to hospital, that they're there for the shortest time possible, they get the care they need, and then they're able to return to their usual place of residence as well. And this is something that really the whole county has very much got behind, working across health and social care. And we think that particularly these vulnerable people within our community, we can really make a difference to their care, make sure that they have the dignity and the independence that they need, and we're really excited about that as a programme moving forwards. Some of the other areas that we're particularly looking at is looking at some of the outpatient and elective procedures that have been done for some time, but actually rethinking what is the right route. So whether you need an operation or you need an investigation, we're taking the opportunity to really look at what do people need, make sure that people's pathways are as smooth as possible, make sure that there's communication across the system, and that people have the most efficient journey that they can moving forwards. And that's a really big piece of work. Throughout this period, obviously, we've made sure that particularly some of the priority pathways like cancer are being looked at, and in particular early diagnosis of cancer. And this is something that's really important to us as a whole system. So albeit there are hospital services, there are also screening services, and there's lots of activity taking place in primary care as well, making sure that people go when they're invited, but also making sure that people do contact their GP surgery when they have worrying symptoms. So when they have blood in their poo, if they cough for long periods of time, if there are some of these symptoms where people might be tempted not to do something about it, we're trying to make sure that these people really do consult. We can get them the care, they can get diagnosed early. And so this is something where we can all work together to make sure people get early diagnosis and the very best treatment. It's also really important that we look after people's mental health and equally to identify when people's well-being is affected, both in the context of COVID, but also other mental health problems moving forwards, and to make sure that people get the care that they need. And we are very much working with our mental health teams, but also with our community and voluntary services, as well as acute community and primary care teams as well, because this is all of us together working to look after people's mental well-being, making sure that there is the investment in those services, which we know people have really appreciated. We've had fantastic success with the mental health hub as part of our COVID initiative, and actually that's something we can now build on to allow people to get the help that they need, to allow them to be navigated to the right services first time, and for some people to use the technology that will give them that appropriate support. So although some people do need one-to-one therapy or counselling, actually for some people computer guided or self-help can be the right route. And we really need to produce those programmes together with the service users. And that's something that there's very much a culture of within our county, is working with the people who use those services to develop the services that they need. And I think one of those things as well is about looking at the outcomes that they want to achieve. So it's not necessarily for the health professionals to decide what is the right course. And this is something we're going to do a lot more of moving forwards, is looking at what is important to our population, what do they want to achieve, and actually as a commissioning group supporting our population to get the outcomes that they need by gluing the services together and helping everybody to work very much in the interest of the population.
Absolutely, Joe. I mean, that's a great sort of canter through there. You covered an awful lot of ground in terms of different priority areas, but certainly would recognise everything you've described there. And it just gives a sense, doesn't it, of the scale of the kind of work that we do across the NHS and the role of the commissioning group in helping to take those different agendas forwards. One other area just reflecting that sort of comes to my mind, I think, is going to be a particular focus for us as well over the next 12 months is how we support our staff and our workforce. I don't mean within the commissioning group necessarily here alone. I mean more broadly health and care workers across the whole of the county. Because my sense, Joe, is that we've had so many people who've been working over the last 7-8 months at a really intense rate, and there's a level of fatigue there, and there's a level of I guess kind of emotional drain as well from having responded and supported people through the pandemic. And so I think as we go through into next year, we're going to have to continue as we already have been to really redouble our efforts on how we help our workforce and our staff in terms of their own physical and emotional kind of health and well-being as well.
Absolutely, and I think it's important that we do recognise everything that health and care staff have done across the system. They have worked incredibly hard. We know that it's important for their morale, for the general public to be kind to them, and actually what a difference it makes to people who are sometimes quite exhausted. And for those of you that are able to say a kind word to the health and care professionals that you come across and the administrative staff and the receptionists, it is really appreciated. It's also really appreciated if you can be kind by wearing face coverings, washing your hands, protecting people around you, being kind not only to health and care professionals, but to the wider population, to your friends, to your family, supporting those people around you, and also being kind to yourself as well is really important. So I think this is a difficult time. We do need a little bit of tolerance for each other, and I think absolutely supporting the health and care staff is going to be a key part of that because we've got a long way to go yet, and there's a lot that we want to achieve together.
Absolutely, Joe. So we talked quite a bit there about kind of the next 12 months or so and some of those kind of key service priorities and then how we support staff. I'm interested looking a bit further ahead than that. It feels to me that one of the big opportunities we've got, the way that the partner organisations across the county have responded through the COVID pandemic, I think really lays the way for how we can carry on working going forward in terms of joint working, and particularly alongside that, the development really exciting opportunities in the county in terms of the development of the 2 new unitary authorities as well, and how that we come together through the health and care partnership. So perhaps tell me a little bit more about the health and care partnership locally and how you see that evolving in more of an integrated system way, perhaps over the next kind of couple of years as we go forwards.
Absolutely. And I think for all the awfulness and the distress of this pandemic, it has given us opportunities. We do have new ways of working across our system, and people are working across organisations. And I think this is a fantastic opportunity for our health and care system to come together, to look at what the outcomes are for our population, to trust our colleagues who are working so hard to devise the right pathways and to make it so that the right pathway for our patients is the easiest pathway. We know it's a confusing system. We know we can make it better. And using programmes like the ICANN programme gives us the opportunity to really work across organisations in the interest of our population. We are looking at very much closer working with our local authority colleagues, both on a county-wide footprint, but also looking at a unitary footprint as well. And I think it's very much about making sure that we look at the right level for the sorts of services that we're helping organisations to design. So some things will work really well on a county-wide basis, and there are really important things that we need to look at to make sure people get equity of care, and that we look at the different health needs, particularly the population health needs and the wider determinants of health across the county. And for those of you that aren't familiar with that term, we're looking at things like where do you live? Who do you talk to? How do you fill your time? All of those things are just as important as conventional NHS services, and those are the things that really contribute to the well-being of our population. We also need to look at things on both the north and the west unitary footprints, with the hospitals and the community services, and also with our general practice colleagues as well. So with our primary care networks, we've got 16 primary care networks, and it's really important that we look at the 6 that are in the north, the 10 that are in the west, and look and see how does that matter, very much on a smaller basis, groups of practices working together to look at what their population needs are, and look and see what services can we provide at that level, working together with the voluntary and third sector as well. And I think there is a huge opportunity to talk about what matters to populations in their place. There are going to be lots of conversations that are going on. Obviously, I know Health Watch is working really closely with us as well to help us have those conversations. And it is really important that we talk about what matters to people in their place moving forward and what outcomes we can achieve working together. Challenging each other, looking at the limited finances that we have, because we still need to spend money wisely. We need to be sensible with the money that we have, and really get maximum benefit for our population, all ages, mental health needs, physical health needs, considering all of those things that we need to be doing in order to get the best outcome that we can possibly manage. And we're really excited about working together. We think this is a massive opportunity for us. And certainly that's something where we can build on the experiences we have, the relationships we have across our system. And I think there is so much more that we can do together than we've ever been able to do separately in the past. So I think this is going to be a really exciting year. There are huge challenges for us as a clinical commissioning group. We couldn't do it on our own. We would like to thank very much all of our partners across the system, both the formal parts of the NHS, but also our wider providers within the system as well. Thank you to everybody for everything that you've done. Thank you to our staff, and thank you to you for the general public for looking at this video, for being interested in what we're doing as a clinical commissioning group. And there will be lots more opportunities in the coming year for us to continue those conversations, to produce services together, and we look forward to seeing you at future events. Toby, any final comments?
Just very finally on your last comment there, Jo, about looking forward to seeing people at future events. I really hope and look forward to a time into next year when we can actually get together again physically with some of our local people, our local population and patients. It's one of the interaction things that, Teams and technology is wonderful. It's great we've got the ability to have this conversation in a public way, but I'm really looking forward to, as well, as I'm sure a lot of other people are, being able to get back further into next year into some way of being able to kind of gather together and have these conversations in the same kind of room rather than just through screens as well. But in the meantime, it's tremendous we've got the ability to have these kind of conversations in this way, isn't it? So I hope people will find some of the conversation we've just had interesting. I absolutely agree with you, Jo. Really, really exciting year coming up. Lots of opportunities, plenty of challenges out there. And actually the backdrop economically and financially across the country is going to be a real challenge into this, in terms of some of the strain and pressure that places on local people in terms of their businesses, in terms of their jobs, in terms of their incomes. And I think the NHS is going to be needed never more so than the year that we're still going into next year. So thank you for that, and thank you for the conversation, Jo.
Thank you.